All right, I'm going to do the vibratory PEEP device checkoff. I'm going to do two different devices today, the Acapella, which I call the pickle, and then also the flutter, which is kind of a horn with a steel ball. In this checkoff, kind of before you go, make sure you go kind of in the patient's chart, make sure they have no contradictions that wouldn't be able to make them do this. And then once I kind of got all that figured out, make sure you got the devices and have them ready. And I guess have them in the room and all ready. So I'm going to enter the room. Hello, I'm Tyler. I'm a respiratory therapist here at the hospital. Today we're going to do a couple different exercises to help with getting some of that secretions moving. That'll kind of prevent any lung fluid buildup and just help you get them out. So let me go wash my hands here. All right, and let me just check your wristband here. All right, and then I'm going to get their vital signs. Listen to their breath sounds. All right, so have you breathe a couple times. All right, and then you're going to check their pulse, respiration rate, blood pressure if it is up there, and heart rate. Have you ever did a PEEP device at all? Anything? No. Okay. All right. Well, the first one we'll start with, they call it the pickle. It's called the Acapella, and in this, you can either use the mouthpiece, which I have here, or you can use, this is the face mask that you can put, or you can use the mouthpiece, which they put their lips around. So on this, it does have kind of some different settings. Usually we'll start with the low, make sure they can do that, then we can move up. So let me start with the low here. Okay, and then all this does is once you breathe into it, you'll kind of feel in it, it'll make it vibrate, so then you're kind of forcing air to get those secretions up. All right, I'll let you do a couple of these. We'll try to shoot for 10. If we can get to 20, that's great. And then we'll do it about every hour or so, or kind of what the hospital rules are at the hospital. All right, so let me get you sit properly. Usually I'll have you sit straight up here, slightly forward. All right, slightly forward for me. All right, now if you just breathe forward into it. All right. I'll have you just take a little bit deeper breath in than normal, and then kind of not a complete forced exhale, but a little more forceful than normal. All right. All right. Okay. And then I would say they would do about 10 or so, and kind of watch them so they're not doing it too quickly and they're kind of hyperventilating. Make sure their oxygen is not dropping too much. And then I'll just move on to the second device and kind of do what I do after that. So the second device here I have is the flutter, somewhat similar. And then I'd describe what it does if they have ever used it. So have you ever used this device?
No.
Okay, so on this it's, I guess they wouldn't have used that one. You'll just kind of take a normal inhalation and then or a little bit more than normal, bigger inhalation, and then exhale kind of forcefully, but not all the way. And I'll have you do 10 or so of those. All right, and then we'll just say we'll do 10 or so. And again, after they're finished with these, make sure if they are, you kind of have them do a little kind of huff coughs if you like, and I'll kind of describe that here. So have you ever did a huff cough?
No.
All right, what a huff cough is you're just going to kind of cough multiple times. So you're going to take a inhale in and then kind of go and try to get that fluid moving after that device has been, because that device moves it up, and then sometimes you can actually expel that, and you want to get that expelled. So after they would do this device, again, I would listen to the breath sounds, check their vital signs, and ask them if they have any questions. If they didn't have any questions, I'd kind of do what tell them what the hospital or different hospitals have different directions on how many use or how often you should use the device and how many breaths. So for a hypothetical reason, let's say the hospital I'm at, we do on a device like this, we kind of let them go on themselves. We try to say at least 10 to 20 per hour, or as many as they can do, with not over exceeding and dropping their air. And then make sure every so often that you're going in to check to make sure they're doing it correctly. And, maybe you need to turn them up on the Acapella here because it gets a little bit harder. And if they're doing that, then that's great. And then hopefully they're expelling those secretions and getting them moved out. After that, I would place the patient back into the position that they wanted to be. All right, I'll set you back here where you were. I'll make sure their call light's close. I'll make sure, you know, the bed's locked or in the lowest position, or if they have an alarm on. I would make sure those devices are close so they can keep on using those. I then would wash my hands, throw anything away that I used, and then I can go leave the room and chart everything, all the assessments and why they used it, how many they did, and all that into the chart.